Okay, this video is more of an advice video for older nurses specifically. I've noticed a lot of people asking me about that online and in person, not as much because, modesty aside, I appear a lot younger in person. Probably on the video, I look decrepit and crazy, but in I present better. I clean up better in real life. Um, Very few. I mean, I could count maybe 2 or 3 fingers. People have guessed anywhere close to my age. Usually, they guess around 30 or lower, which I was shocked. I'm very happy as such, but I'm nearing my 51st birthday. So I don't get the question as much until they know how old I am. Then they ask. But invariably, the question is, how did you do it at that age? And I'm like, there are people. I went to school with people that were older than me, even. Not a lot older, but I've known a couple people that also were older, a couple years older than me when they were already in their 50s when they started school. So it's not impossible. It's not what you call it, undoable. Not at all. Most of the prereqs that I took, I would say 90% of the older people that I took the prereqs with made it to nursing school, and I would say probably a good 75%, ballparking those figures, obviously, made it through nursing school. Whereas the polar opposite was the case for the younger crowds. And let me preface and define that by saying older, and I mean by above 35, in that range. That's anything above that, I would say, is older. Anything under, let's say, 25 will be younger. And that's I'm skipping the middle there. There was just a lot more weed out on the lower, the younger age bracket. The older age brackets survived that a lot better, and I think that is one of the that evidences some of the benefits of being an older nurse student. People are like, "What benefits are there? You're older." Believe me, when you're a nurse, I don't see a benefit. Not too much. There is still some, and I'll get to that. First and foremost is life experience. It really doesn't count in a lot of things except here. Maybe on the job, actual use, yes. But when you're trying to get the job, it doesn't really count. It doesn't really even count in nursing school, med school, or anything. Some places say they count it, but I don't really think so. But when in actual application of nursing student, the grind, the commitment, the sacrifice, because you have to be able to sacrifice, is there for us as older adults. We've gone through so many trials and tribulations in our lives already, whether it's relationships, work, life in general has dealt to us life, and you learn to go beyond it and push through it and take it. Whereas our children, which are our younger bracket there of nursing students and other students, don't have that yet. I didn't have that when I was their age. You didn't have it probably if you're watching this and you're older. So that's one big benefit that we have over the younger crowd. So don't say, oh my God. Don't get me wrong. They have a lot of advantages. I'm not even going to list them. They have a lot more advantages than we do. But we do have these few advantages over them in general. And this is in general, just in general. The other advantage that we have is what I call emotional intelligence versus technical intelligence. How the stereotype is younger kids know how to program VCRs and cell phones and whatnot. Yeah, that's what we heard growing up, and now it's cell phones. Yes, they are very astute at that. Apple Watches and all that jazz. I don't know squat about that stuff. But emotionally, dealing with a combative patient dealing with, disruptive family members, disruptive people, or whatever situation. We have an advantage. I've seen that over veteran nurses. Anyone with over 5 years is what I call pretty much a veteran nurse. Anything below that, you're still kind of a newbie. I'm a super newbie. I'm an infant nurse. But we have advantages that just because we've lived decades more than these people, and we know how to adjust and deal with that, whether it's in the shopping center, like supermarket, on the road, in work instances, what have you, dealing with superiors, subordinates, co-workers, equals, whatever you want to say. We have that life experience, that emotional intelligence that they're lacking just because they don't have the experience for it. It's like what I say about you're being stupid or you being ignorant. They're just ignorant of that because they haven't learned it yet. They will, definitely will, and they'll become fully rounded individuals. Not they're great nurses, but fully rounded individuals. We're individuals that are pretty much fully rounded. We just need to learn how to become good nurses, competent nurses, technical nurses, like a lot of those veteran nurses are, whether they're young, old, or what have you. So that is a big plus that we go into this journey, advantage-wise, emotional intelligence, having that ability to just think on our feet and deal with people. Because guess what? Dealing with people is the hardest and most important aspect of nursing, because they're your patients, your doctors, family, whatever, what have you. You're dealing with people. It's like retail. Ooh, right? That is our most important job, patient safety, of course, but I'm saying, beyond that, doing what you're supposed to do. And that's what I'm talking about, the technical side of nursing. They have, the younger crowds have down, or the old nurses that have been in the industry for whatever already have. We need to learn that aspect. But as older individuals going to this game, we have that advantage. So, buck up, stay in there, keep your nose to the grindstone, all those sayings, hang in there. Once you get through the journey, you're going to join the brotherhood, the sisterhood, and, know that you do have a few advantages and a few strengths going in, no matter what, okay? You're not completely, avalanched, I'll go into some other things in the future videos about what I've been hearing back from people and viewers. Okay, take care.